is my absolute pleasure to welcome each of you to Still We Rise, an honest conversation on Black America today. Tonight's webinar is the fourth webinar in a 5-part webinar series titled Conversation with Professor Brown. Welcome to each of our panelists, Millicent Alexander, Professor Angelique Cook-Hayes, Nicole Peltier Lewis, Brenda Porter, Lakeila Stemmons Esquire, and Dr. Dorian Thomas. It is a true blessing to be in the company of such amazingly talented thought leaders this evening, to have an honest conversation about how COVID-19 and social unrest is impacting the Black community, as well as how minorities can sustain optimal health, quality education, gainful employment, improve relationships with law enforcement, caring for elders, and participating in the 2020 presidential election. To our attendees via Zoom, Facebook Live, and phone, thank you for joining us. Tonight's webinar includes 6 segments and a question and answer session. Please type your questions in the chat. When we transition to the question and answer session, we will make every possible effort to answer each of your questions. However, please email me at tanya@tanyaandbrown.com if your question is not answered, and I will forward your question to the panelists to ensure that you receive a response. And now you will hear personal introductions and greetings from each of our panelists, starting with one of my very closest friends, Millicent Alexander from the United States Census Bureau. Millicent?
Good evening, everyone. And Tanya, thank you for having me this evening. I'm very grateful to even have been included in this panelist of all of these amazing women. My name is Millicent Alexander. I am a Hampton University graduate. I've been at the Census Bureau for a little over 30 years, and I'm just glad to be here. Thank you.
Thank you, Millicent.
Good evening, everyone. I want to echo what Millicent said. I'm very, very honored to be a part of this panel, and I thank Professor Brown for having me with these amazing women. I'm a professor of English and criminal justice at Baltimore City Community College. I'm also a retired Baltimore City police officer, born and raised in Baltimore, educated at one of Baltimore's HBCUs, Coppin University, and I was also educated, received my master's degree from Towson University. So I'm a Baltimore bred woman, and I'm also the proud mother of 4 amazing children. So,
welcome, and thank you for being here.
Thank you.
Nicole?
Good evening, everyone, and thank you so much, Tanya, for having me. It's always an honor to be on this platform with you. My name is Nicole Peltier Lewis. I'm an educator, author, and coach. I'm presently the principal of Annunciation Catholic School in Washington, D.C., and a graduate of the George Washington University.
Thank you, Nicole.
Mother of 2 great boys.
Yes. Brenda from Atlanta.
Well, good evening, everybody, and thank you, Tanya Brown, for having me. And I, too, am very honored to be amongst such powerful women. I am a theater professional. I have a degree in theater from the University of Georgia, and upon graduating, set off on my career. And I teach, I act, I direct. I have a theater company of my own, a small theater company of my own, and I work with seniors in theater. And so I'm very excited to be here this evening and talk about my work with them.
Thank you, Brenda. Lakeila?
Good evening, everyone. My name is Lakeila Stemmons, and I am, like all of these other amazing Black women who are leading in this moment, truly blessed and grateful to be here this evening. Tanya, thank you so much for including me. You have convened an amazing panel of Black women that I am actually really excited to hear from tonight, because I know that they are going to teach us all I know they're going to teach us all something. I am an attorney by trade. I am the CEO and principal of Stemmons Strategies, and I also serve as the National Director for Higher Heights for America.
Thank you. Dr. Thomas?
Hi, my name is Dorian Thomas. I am a radiologist in the Washington, D.C. area. I am the medical director and co-owner of a radiology practice in Laurel, Maryland, in Prince George's County, one of the wealthiest African-American communities in the nation. And I'm just very grateful to be a part of this wonderful panel. And I thank Tanya so much for including me. And I hope that I can represent her well. Thank you.
Oh, thank you, Dr. Thomas. Well, we're going to get right into it, and we're going to just welcome you into our homes and hearts to have this deep dive and very honest and transparent conversation. And we're going to start off talking with Professor Cookays, and we're going to talk about the police brutality that we are seeing in our country at this time against African Americans. So, Professor Cookays, over the last few years, America has witnessed an increase in police brutality against African American men and women. What was your initial reaction when you saw the video of George Floyd and Rayshard Brooks being murdered?
Well, first of all, and thank you for the question, Professor Brown. First of all, when I saw the video, I was horrified, like many people were. And I was asking myself, where were those officers taught to do something like that? Like, that was not something that was what I understand and what I know about police training in terms of arresting suspects. Rayshard, that incident, also, my first question there was, why did a simple stop for someone who fell asleep in a vehicle escalate to wanting to arrest someone and the person being shot and killed? And looking at both of those incidents, I, like many people, realize there's a huge disconnect between the police and the community. Mm-hmm. In my opinion, in those instances, the officers forgot or did not remember that their main role as peacekeepers, they serve the community.
Yes.
And instead of always thinking, I'm here to arrest and to occupy, no matter what the color of the skin, no matter what color of skin the citizens have in that area, I am here to serve, be a public servant.
Thank you. In your experience, how do police departments typically handle officers with tainted disciplinary records like we see in the case of Officer Derek Chauvin?
Unfortunately, well, not unfortunately, officers are protected by something called the Law Enforcement Officers' Bill of Rights.
Okay.
Typically, in the officer's first year of service, he or she is on probation. After that year, the officer gets protected. Police officers have what is called a union, which is the Fraternal Order of Police, which is one of the strongest unions in the country. And because of the Law Enforcement Officers' Bill of Rights, before a police agency can fire an officer, there's a series of things that must occur. So oftentimes you have problematic officers who go through an internal review after they face criminal investigations. And unfortunately, even in my time as an officer, I saw several officers who were just put into different places in the department where they could no longer, and I'm talking about offenses, everything from perjury in terms of lying on the witness stand and falsifying arrests to assault against citizens. But thank God in recent years, because of video cameras, the proliferations of video cameras, not in our phones, but in our communities, a lot of the things that have been going on for decades are now coming more in the public eye. The Black community already knew that these things were going on, but the wider community is now aware of some of the things the Black community has faced So a lot of officers, I have to say, in the past, they weren't, unless they were extremely egregious, like committing a murder or something like that, they were oftentimes put into other places in the department.
And speaking of that, in light of the numerous unjust police brutality cases involving the abuse or murder of African-American men and women, what tips would you give to African-Americans when interacting with law enforcement?
Well, my tips are, number one, to stay calm.
Okay.
If you can, because oftentimes when there are encounters, there's already a distrust. So, you know, the best thing is to remain calm. If you have a phone, you know, keep it on, keep it recording. And just, I would say, follow the directions of the officer. Try not to get into a debate or conflict, because remain calm, which even George Floyd tried to remain calm. He lost his life. But my advice, everything from a simple traffic stop, obey the orders of the officer. Make sure the officer sees your hands for your license. Okay. Encounters on the street, I just encourage the citizens to remain calm. And if a person encounters an officer who you believe was brutal or unjust, there is recourse. There are internal affairs units, and you can actually dial 911. I know here in Baltimore, and make a supervisor's complaint, which is recorded. All 911 calls are recorded, and say, hey, I just encountered an officer at this location, and this is what he or she did. And it will be investigated. Okay.
Thank you. And what do you believe are solutions to end police brutality against African Americans?
Some of the brutality is, like we hear a lot about people talking about defunding the police. It's not really saying we don't need a police department anymore, but some of the calls the police get called out to are unnecessary, and the police should not be involved. And some of these incidents lead to incidents where you have police brutality. For example, right here in Baltimore right now, about 5 years ago, we had unrest because of the death of a young man who was in police custody. And then there was an investigation by the Justice Department. We're under a consent decree. So today, a judge, so the consent decree means that the police department has to go through a certain amount of measures and changes to comply with the federal government. And the federal government is where we get a lot of our funding. So we must comply with what they've asked us to do. But, you know, incidents where you have someone who's in a mental health crisis, or where people, and I remember as an officer, I would get calls where people said, I can't deal with my kid. I want you to say something to my child. That's not for the police to do. Unless somebody's life or property is threatened, the police, we can have social workers or mental health counselors. And I think a lot of these incidents that you're seeing and they get out of control are because these are calls that police should not be going on at all. It should not be called to. And in Baltimore recently, in terms of the consent decree, there was a recent incident where a man who was having an obvious mental health crisis ended up being shot in the basement of his home. And if a mental health professional had been on the scene, it wouldn't have gotten to that point. So I say that police departments need to, number one, to cut down on these incidents and really gain the trust of the community again. We need to be concerned about who we hire. Make sure those people, a concerted effort to make sure these people understand that they're public servants. They're not just here to arrest and occupy. This is not the military. You know, you're with citizens. And also learn more de-escalation techniques. When I was an officer, there were many things I could arrest people on, many things. But in many cases, I did not arrest. If someone was intoxicated and they were sitting in their car and they did not cause an accident, I would take the keys and say, hey, call a family member. I've had my family who had police officers, you know, contact other family members and say, hey, your family member has been drinking too much. Can someone come get him or her? So That's how they need to be more problem solvers. And even in the academy, we need to teach more critical thinking skills and more community oriented. So that's how we can decrease all of this police brutality that we're experiencing.
Thank you so much, Professor Cook-Hayes, for your service to Baltimore City and to the students in the Criminal Justice Department at Baltimore City Community College. If you are joining us via Zoom and you have questions for Professor Cook-Hayes, please type them in the chat. She may have a chance to respond as we transition to our health segment, but we certainly will make every effort to answer your questions when we get to the Q&A. So Dr. Thomas, COVID-19 has impacted African Americans in far greater numbers compared to other races. Why do you believe this is the case?
Well, Tanya, thank you for that question. It's a very important question that needs to be addressed. And I think the COVID-19 has really kind of unveiled the racial disparities that have occurred in this country for a long period of time. And there are some media reports, for example, as in Chicago, where you have about 1/3 of the population in Chicago that is Black, but one half of the people actually, one half of the Black community contracted COVID-19, and about 3/4 of the deaths in Chicago occurred in our community. So this is really significant, and we can look at the reasons why, and it goes back to really some of the socioeconomic factors that we've had to deal with for a very long period of time. And one of those, of course, is some of the crowded living conditions that we've had to endure as a result of the disparity in housing, some of the segregated housing that we've had to deal with, the rent. So you can only imagine that if you're in an apartment where you have very limited space and you have a large number of family members in that house, how difficult it is to social distance, right? Yes. So that is a huge problem if you're living in tight quarters. So if someone's walking around who may be an asymptomatic carrier, could potentially give it to other family members without even knowing it. And we also recognize that there is essential workers. We are involved in environmental services, food services, involved in transportation sectors, and we're also home health providers. We're not the ones that often have the luxury of being able to stay at home and do telework. We're the ones that are on the front lines. We're at the grocery stores. You know, we are working in the, like I said, the food services. So it's very difficult for us to, you know, to maintain that social distance when we're in front of the public for a long period of time. Number one cause too can be considered, you know, our poor access to healthcare. We're either uninsured or we're not insured, period, right? We're underinsured, we don't have insurance. So we can't go to those doctor visits when we have those medical concerns, such as with heart disease or diabetes or obesity. You know, we have poor access to good food, which can also be a result of us not being able to take care of ourselves in a healthy manner, which makes us predisposed to getting COVID. So those are some of the things that can also, we have some chronic health conditions. You know, we're dealing with diabetes and heart disease and lung disease, and all of those can make us very weak in terms of our immunity. And then of course, just dealing with stress. You know, we live all the time. We're talking, you know, inequality in terms of like we talked about living conditions, about income inequality, the violence, all of those things. We know that stress has a direct impact on our ability to fight against disease. I can tell you that during this crisis for myself, every morning, I actually took an immunity boost. And I truly believe that helped me because I'm in the front line as well. But I was very fortunate not to have gotten COVID. And I do attribute that to some of the interventions that I did during this crisis by using some of the nutritional things and exercising, trying to make sure I had a balanced diet and getting my 8 hours of sleep. All of those things contribute to our ability to fight off and ward off disease. And so that's considered, you know, one of the reasons why we may actually be prone to or getting exposed to COVID-19.
Thank you so much. With this understanding, what is the most effective way for African Americans to manage our health now that states are no longer mandating a quarantine?
I would say of course, we have to follow the CDC guidelines. I mean, that is really critical. I mean, we need to make sure that we do have our PPE. I mean, we've gotten somewhat comfortable over these last months, in which you can see some of the surges that that are demonstrated in some of the states where we haven't been doing the social distancing. We haven't been masks. We might not have been washing our hands as thoroughly as we needed to. And we talk about washing our hands, we're saying about 20 seconds of using good soap in order to remove the germs. And if we don't have that, we need to make sure that we use hand sanitizers. We also need to make sure that we go back and we, get in contact with our providers, through telehealth. So we need to make sure that we are able to take care of our basic needs that we might have postponed during this crisis.
Thank you so much. And what best practices are you using at your radiology center to ensure safety of your staff and patients?
Well, one of the things, we actually police each other in the office, and that if we hear any sneezes or any coughs in the office, everyone sort of looks and wants to make sure that that person is not sick. And I certainly make sure that the staff, when they come to the office, they have to be well. They cannot come to the office if they have a runny nose or fever or cough or headache, some of those symptoms that we know are tied to COVID. Everyone has to be checked each morning to make sure they do not have a temperature. And they have, when they walk in the door, they have to hand sanitize. Hand sanitizers are throughout the office. So make sure that, the hands are clean, because there's a lot of contact with the surfaces in the office, particularly when we're using equipment. So we have to make sure that, everything is disinfected on a regular basis. So when patients come in the door, we actually, make sure that their hands sanitized. They also have a temperature check. Everyone has to wear a mask. All the staff wears a mask. We've had a few patients that they wanted to come into the office without a mask. We've actually had to turn them away because we really feel that's just something that we feel has to be done. It has not yet been mandated in our state, but we have it as a policy in our office. And because we are a private office, we have demanded that from them. So, each patient, when they leave, we escort them out the door. Any of them that use the bathroom, we make sure it's disinfected. So we try to maintain a very, very strict hygiene policy in order to minimize us getting sick and also to prevent our patients from getting sick.
Thank you, Dr. Thomas. And how can individuals in Maryland who have COVID-19 symptoms get tested? And what are the different types of tests available to citizens?
Well, there are two types of tests. There's one test is called the viral test, and the second test is called the antibody test. Now, the viral test is actually a test that will tell you whether or not you have COVID-19 at that time. So that doesn't mean that if you don't have it that day, it doesn't mean that you won't get it or you won't turn positive the next day. And so we really recommend in the state of Maryland that everyone be tested, because we do know, as I just discussed, that there are asymptomatic carriers that can infect, okay? And anyone that has been exposed to someone who has COVID-19, we recommend that they also be tested. And I would say also, if you have any symptoms, and we've talked about some of those symptoms where you have symptoms such as a cold, fever, runny nose, a sore throat. Some of the other symptoms can be a headache. So those are some of the symptoms that you may encounter, and that is when you should get tested. The second test is what we call the antibody test. So that basically tells us whether or not you have been exposed. So that means that you have developed a protein in your body that says that you have been infected at some point. Now, what does that actually mean? That means that if you have been infected, that may provide you some level of immunity going forward, but that we're not exactly sure if that's the case. All of this is kind of fluid right now. We don't know exactly everything about COVID, and we're learning as we go from day to day. So your doctor may suggest that you get tested for COVID with the antibody test if you may have had those symptoms, but you weren't sure, okay? It might also be required if you're going into the hospital and they want to know whether or not you might have been exposed. So they may suggest that you get the antibody test before you have the procedure. And it's really, you know, more of a humanity issue in terms of perhaps providing your plasma for someone who might be infected, who could use your antibodies to protect themselves against COVID-19. So those are essentially the two tests. Now, we know that the state of Maryland actually has provided basically 200 centers around the state of Maryland where you can go online to get information on those testing sites. And they are at a lot of the emission testing facilities that have been transitioned into a testing facility. Initially, those sites may actually require you to make an appointment. But because, you know, there are so many patients that have already been tested, you may not need an appointment. So when you go online, you might find out whether or not an appointment is necessary. The place closest to me, we initially required appointments, but now it's pretty much on a first come, first serve basis. So you will actually you'll go in, it's a drive-through, and you will be tested either by a Q-tip, which will go into the nose, into the nostrils, usually both nostrils. It's not uncomfortable. It's a very quick examination. And you might actually, for lack of a better term, you might have to spit into a cup where they would do a saliva test. And those for evaluation to determine whether or not you are COVID positive. Now, initially, these tests took about 3 to 5 days to get the results. Unfortunately, because of the volume of cases that they are testing, it's now taking close to 7 to 10 days to get results. So you could be negative right now, but you may be negative when you leave. So you really have to make sure you maintain good practices, even when you're waiting for the results of these tests.
Thank you so much, Dr. Thomas. If you have questions for Dr. Thomas or comments, please type them in the chat and we will respond to you during the Q&A. Now we're going to transition to Brenda Porter and talk about the importance of working with the elderly during these times and caring for the elderly. Brenda, you are an art educator who primarily works with the elderly. What inspired you to start working with them, and what do you specifically teach?
Well, I actually started working with them strictly by accident. A friend of mine asked me several years ago if I would work with seniors. I said, oh no, I don't work with seniors. And she convinced me to work with them just for 3 months while they looked for another theater director teacher. And that was 20 years ago. I walked in, I was not a senior at the time. I am now, but I was not a senior at the time. And they touched my heart, and I found out that I was learning as much from them as they were learning from me. I've learned about growing older gracefully. I've learned about acceptance of life and people and situations. I've learned so much from working with them. But I teach them theater. And most of them are people who have, at some point in their life, wanted to act or wanted to get involved. Maybe they wanted to write. Maybe they wanted to do some backstage stuff, but they always had a creative side to them. And they are now in their late 50s all the way to, I think my oldest person that I teach in my class is 87. And they are out there doing their thing. And they're learning and I'm learning. So yeah,
this is beautiful. One of your students is on the line on the webinar, Betty Cheney, who was with us a couple of weeks ago, and she's on tonight from Tampa, Florida. So you really are having a positive impact on the community, Brenda. You are also a caregiver for your partner's mother. How have the two of you managed caregiving during the COVID-19 pandemic?
Well, it's been also a learning process because we initially thought that it was going to be 2 to 3 weeks. You know, we're gonna take care of her and for 2 to 3 weeks. And she had at the time she had a caregiver that came in for about 3 to 4 hours a day. But the caregiver could not be with us anymore for various reasons. And so it's been a juggling of time, of trying to manage, because she has mobility issues in terms of balance, and so we cannot leave her in the room because she might stand up and fall. So it's been a learning process with her. It's been, we have been extremely careful because as with all even the seniors I work with, all of them that I speak, with whom I speak, all are being very careful. They're doing their PPE, and and even with that, one of my students was asymptomatic and had.
Oh, wow.
So, but we are extremely careful. Even though we might go out to the grocery store or to the gas station or to some place, we are doing all of those things that have been recommended at some point.
Yes.
We come home, we change our clothes, we wash our hands. When we speak with her, we have our mask on so that we are always in her presence. We are always protecting or making an effort to protect her, because not only is she 85 with health issues, but she has the mental issues of dementia. And it's harder for her to be able to tell us that she's not feeling well or there's a problem. And we don't know sometimes if the problem is the psychotic elements of the disease or if there's an issue with her health-wise. So I really would recommend for anybody else who is working with it, you're extremely careful, because we don't know what we can pass on. And we don't want, as Dr. Thomas said, we don't want to be asymptomatic and passing them on to us. We've been extremely careful.
Thank you for sharing your experiences, and thank you for echoing Dr. Thomas's suggestions that really the tips for caregivers are to really be careful, wear our PPE, take our clothes off when we're out, wash our hands. So thank you so much, Brenda. If anyone has any questions or comments for Brenda, please type them in the chat. Now we're going to have a conversation about the census. Millicent, what is the primary purpose of the census?
Well, short and simple, to count people. It's basically it's basically to count the population.
Okay.
And it's so, you know, I've always learned KISS. That's the simplest way that I can tell it is really to count the population, and we only do it every 10 years. But that does not mean that throughout that 10-year period that we are not prepping to count the population, because, you know, some of the population are transient, right? So you have to find them. Then you have the nursing homes that you have to go into to count that population. You know, you have people that may live in somebody's garage, you know, so every piece of the population is what the census is about, actually counting people.
And how does the census impact critical long-term planning?
So census is extremely important in long-term planning, because the results of the census actually go towards federal funding. And I don't know that a lot of people realize that. And so basically the way it works is the more money that goes, the money goes to places with the most people. Okay. And so if you don't, so let's just say, you know, in your household, you don't count the number of people. And even the college students, like college students are even counted not in their household, but where they actually are. So that does help, you know, those towns and cities that have colleges, because those students can be counted, you know, actually where they are. And so the long-term planning is very important because that's where your roads and your schools and your community centers and things like that come from, is the funding that comes from people taking the census.
Thank you. And how are communities negatively impacted when citizens do not complete the census?
Well, there are a couple of ways. So right off the top of my head, you don't get the funding. I remember being on or listening to a press conference that our county executive did, and she was stressing how important it was to take the census, because in 2010, she talked about the millions of dollars that Prince George's County had left on the table. And that's basically what it is. When you don't take the census, you literally are leaving money on the table. The other thing that the funding impacts is states gain or lose seats in Congress and electoral votes, which, as we know, we have a presidential election coming up this year. And so, you know how you hear them talking about presidential electoral votes? You lose those seats because if the population changes in your city or in your state, you lose those seats. And so that's something very important to understand and know, because that ties right into voting. So it's very important. You know, voting is not just, oh, you just going to, you know, push a button or, you know, mark something. It's more than that. It's way more than that. And we have got to, as the Bible teaches us, to be more educated and knowledgeable about things that we're doing or not doing and how they will impact us when we don't do those things.
Mm-hmm. Thank you, Millicent. Millicent, I know you have a couple of links for us that you're going to type in the chat. One, how we can complete our census, and another one telling us the statistics for our respective states. So
yes,
thank you
and
so much.
I will type those into the chat, because it's not too late. If you have not done your census, please go to 2020census.gov and you can still take your census. The other thing that I found to be very interesting is, if you want to check, because I did it today, I actually went to the link to check to see how the state of Maryland was doing in their census. And we actually have 66.2% of people that have filled out the census. We have a long way to go. We need to be 100% in filling out that census. But you can, and I'm going to send this link also, Tanya, because you can even do this down to your county, your city, to see who, you know, to see how well your county or city is doing. So I'm going to type those in the chat for you also.
Thank you. Thank you
You're
so
welcome.
much. And now we're going to talk about voting. Lakeila, you are the National Director for Higher Heights for America. Tell us about Higher Heights and what you're doing in the community to support African-American women in politics.
Thank you. Higher Heights is the political home for Black women. We literally encourage and support Black women who are civically engaged, all the way from the election booth all the way to elected office. Our goal is basically to make sure that we are empowering and activating our networks, and that we arm Black women with the tools so that when they get to the ballot box, that we can collectively flex our political power. I think one thing that holds true that we can all agree is that when Black women go vote, we do not go to the polls by ourselves. We bring our children, we bring our family, we bring our sorority sisters, our church members, our husbands, boyfriends, sons, we bring everyone with us. And so the goal of Higher Heights is to make sure that we have informed voters and that we are truly empowering you to, you know, flex your political power and to have your voices heard.
Thank you. 7 of the nation's largest cities now have African-American female mayors. How do you believe the COVID-19 pandemic has intensified their leadership roles?
I think everybody would agree that Black women are the defenders of our home, our community, and our country, and that at this moment of crisis, that they are prepared to lead in the moment. From Muriel Bowser to Latoya Cantrell to Keisha Lance Bottoms, Lori Lightfoot, Vi Lyles, London Breed, you see these women standing in the forefront and truly leading because at the reality, they realize and they know that it is our community that has been disproportionately impacted. Whether it's from healthcare disparities, from being on the front line as workers in healthcare, as nurses, doctors, other healthcare professionals, to educators, to grocery store workers. This is us, and they know that we are also the ones who are going to be impacted first, whether it's because we're underpaid and underinsured, or because, again, we are truly the defenders of our democracy, which means that we are on the front lines and we care for our families. And so I think you see them leading and leading strong because they've always been prepared for this moment. I think anybody can agree that oftentimes Black women truly are natural born leaders because we don't have another choice.
Absolutely, absolutely. Many young African-American women are demonstrating tremendous leadership skills in our communities today. What academic majors do you suggest for African-American girls who want to go into politics?
I would tell them to pursue whatever their hearts desire, to go for their dreams. I don't think that there is a clear-cut way into politics. Perfect example, you have Congresswoman Lauren Underwood, who is a nurse by trade. And she is one of the most phenomenal congresswomen that we have seen and who is leading also in this moment. Another example is Congresswoman Johanna Hayes. She was a teacher by trade. I think that what I would tell any young woman interested in politics is to find your purpose, hone in on the skills that that are needed to succeed in that role. But most importantly, follow your heart, because, when you get into politics, you are truly a public servant. It's not a job. It is where your heart leads you. And so you want to go in and be able to do something that you love, because if you're doing it just for the title or for the paycheck, and mind you, a lot of, public servant positions do not pay that well, but it's truly what you consider your lifeline. It's truly what is your heart's work. And so if it leads you into public service, into politics, you're going to do it because you love what you do, and you're going to love it even when times are hard. I think if we ask anyone who is on Capitol Hill, whether it's a staffer, whether it's a member, whether it's someone even on local government, these are extremely, extremely hard times. And what keeps them motivated, what gets them up every day and to be able to just grind through it is because it's something that they love.
Thank you. So have you seen trends in particular professions that feed into politics if someone doesn't start out as a politician?
I will say I do see a trend, and it's actually, I'm glad you asked that. I think a lot of people transition into politics after they have served another politician. I would recommend anyone, especially starting even at high school, to start seeking internships on the Hill. The Congressional Black Caucus Foundation has an amazing program that will allow college students to intern as a high school student. I would wholeheartedly recommend you look to your local elected officials. Look at your mayor's office, look at your city council member's office. And most importantly, I would also say, look at your commission, like your county commissions, look at the election commission. I mean, I would say learn as much as you can about the political process. Unfortunately, civics isn't taught in high schools anymore. So it requires work, but I would also just, pay attention, reach out. Social media is a beautiful thing. Reach out to someone whose work you admire. Ask your parents, ask your friends. Yeah, that's what I would recommend.
Thank you.
That's the trend that I've seen. It's people who tend to go into politics, they started it very early.
Thank you so much. If you have any questions for Lakeila, please type them in the chat. Thank you so much.
You're welcome.
Nicole, you are a principal, coach, educator, mom of two, and we know that many schools are making changes and finalizing their plans for the 2020 and 2021 academic school year. What is the plan for Annunciation Catholic School for this coming school year?
So thank you, Tanya. So one thing that all have to recognize sometimes is that this is a time of uncertainty for everyone. And so as in every organization and every form of leadership, we're looking at how do we keep our people safe? And when we're dealing with educators,
You're here. You're
when
here.
we're dealing with educators, we're saying, how do we keep the most precious among us, our children, safe? And so, and it's a fluid process because the numbers change daily. The outlook changes daily. So at Annunciation, what we have done is proactively, we created a distance learning platform. So we were the first school approved for 100% distance learning platform, which we call Annunciation Global Campus Initiative, because we were thinking about kids who would be immunocompromised, kids who just parents would be afraid. We didn't know what it would look like at this time when we started that conversation in April. But we now see that that is an option that families are seeking. But we are also offering a modified classroom experience. Okay. And because we're a very small school, but even in that conversation, we're soliciting more and more from our parents, their thoughts. Where do you feel okay with a modified 4-day schedule with one virtual day? Do you feel uncertain about, do you need a 5-day-a-week schedule? And so we are constantly surveying our families, and we just actually put out another survey today to to stay on the pulse of how they're feeling right now. And we have planned for each and every scenario. So that's what we're doing at Annunciation.
Yes. So Nicole, how can parents enroll their children in your online program?
Okay, so for our online program, you can go to our website, which is www.annunciationschool.net. And I'll be sure to put it in the chat.
Thank you.
We're a wonderful small Catholic school in the District of Columbia, but we're taking students from all over who want a strong faith-based distance learning opportunity.
Thank you so much. And for those students who will be returning to the building, you shared with us that you got this amazing grant, and I'm just amazed by the number of masks that you have acquired. Can you please talk about that?
Well, I think every jurisdiction is looking to find out what they need to do to mitigate the risk of students that's returning to school. Mm-hmm. One thing that we did at Annunciation is that we were able to secure a grant from the Department of Health and Human Services for PPE. And so we were able to basically get enough masks for students every day and for every day of the school year so that they'll be able to be safe. And that's just a small way for us to ensure, I mean, we're looking at social, how do you social distance in a classroom? How do you keep students that way? So there's just so many factors that we have to take in consideration in terms of opening. And we're doing it prayerfully and we're doing it safely. We have scientists on our board as well, helping us through the process. So we're following all the CDC guidelines, AAP, the Department of Health in the District of Columbia. So we're not going it alone. It can't be put together haphazardly because our children are at stake.
Absolutely, Nicole. And what strategies would you give to parents who are going to be with their children in the fall, working from home, balancing their work responsibilities and teaching their children if their children are going to be homeschooled?
The reality is it has been difficult for families right now. We have become learning coaches, and as for us as women, we are, you're working 12 hours from your computer on Zoom while your students are trying to figure out how to access their Google Meets. And then you still have homework, and then you still are trying to hold them accountable. It is definitely a challenge. However, as Lakeila said, we rise to the occasion, and as African American women, we have to continue to understand that education is the key for our children. And so if it means that we go on Khan Academy, even if the district that we're in doesn't have the appropriate supports, we do that. If it means that you teach them how to cook and you measure, instead of just throwing the flour into the biscuits, you measure the flour and you give them a lesson on measurement, you do that. But you make every opportunity for the student, for your children to learn and equip them awesome opportunity to learn about our history, our culture, right? The current events that are happening right now. Have them read nonfiction text. Make them dive into it. Make them speak in full and complete sentences. No, yeah, no, no. You want to eat? You have to tell me what you want, when you want, how you want it. Hold them accountable. Hold our kids accountable. And even when you're tired, keep doing that, because we need to ensure that they don't have that unfinished learning be a crux later on in their future. So I feel stand in the gap for our children right now and advocate for them. I'm very passionate about that. So read, children, have them multiplication tables, whatever it takes, but ensure that they're successful.
Thank you, Nicole. Nicole, you have blessed us. You have a poem that you have written for the panel and for the attendees dedicated to African American women, with which you're going to share with us before we transition to the Q&A. Nicole?
Oh, thank you, Tanya. It's called Hues of Promise, and I wrote it some time ago, but I think as we're looking at all that's happening in the world, it really talks about our condition as African American women and how we're able to strive for excellence in spite of it all. Born on a Tuesday, skin the color of turmeric and cinnamon, fierce hues of promise. Personality, savory like foods from mama's pepper pot, sure enough. As she grows, she is told to brace for the storms her life will hold. In the meantime, indulging on the sweetness of innocence, juju beans and ice cream cones, shaved ice from the corner store. Fast forward, yet time traveled, only to bring back the pain rooted in a time so far, but not far away at all. She, with the hue so beautiful, finds herself immobilized, shackled by the spirits that seek dominion over her story, generational darkness, demonic hosts staking claims to eradicate her future glory. Purpose legions of invisible defense, angels, ancestors come to her rescue and carry her on their wings to safety, ministering and equipping her with the sucors of strength, the elixirs of hope, the food of fortitude, the refreshing waters of resilience, the ground for grit, the anointing of abundance, the light of liberation, and a compass that leads to a destination set by the divine. Yes, greatness lies within her, like still seeds in fertile low country soil, ready for the first rain to explode.
Thank you, Nicole. That was absolutely beautiful, absolutely beautiful. Thank you. So I see one question in the chat that is for Dr. Thomas, and ladies, feel free to pop into the chat to make sure I'm not overlooking anything. But Dr. Thomas, one of our attendees wanted to know if you could talk a little bit about vitamin D and how it can be beneficial to our health.
Well, vitamin D is a very, very important vitamin, and it's not one that we can acquire easily. It's one that you really, it's a vitamin that I actually take on a daily basis, about 1,000 milligrams a day. And it really helps with the immune system. And you can also obtain your vitamin D by going outside on a regular basis. But it is a very important vitamin for various things in terms of our ability to deal with stress. As you know, a lot of our diseases are caused by our diminished immune function, the diminished immune system. So it's very important for us to get that in our diet. And you'll be very surprised that, you know, particularly for someone like myself, where I'm actually in my office for periods of time where I'm not out in the sun, I'm not getting enough vitamin D, which makes me prone to a lot of different deficiencies that are related to vitamin D. So it is a very important vitamin, and it is something that you should try to get and go to the lab and find out where your levels are. You'll be very surprised at the number of African Americans that are vitamin D deficient.
Thank you so much. If there's anyone that would like to raise their hand and come on live and ask one of our panelists a question. Any questions? All right, it doesn't appear that there are any questions. And so we're gonna transition to a closing. And I want to thank everyone for being with us this evening. Again, those of you who have joined us via Zoom, telephone, and Facebook Live. It's been a pleasure to have you share the space with us this evening. And I, just as I shared it in the beginning, in the introduction, I have just been so blessed to know and interact with this amazing group of African-American thought leaders. So I thought that I would end with just a brief exercise and say to them, going in alphabetical order, starting with Millicent, so we could please all unmute ourselves. When you hear the names of the following thought leaders from different generations, share one word that comes to mind. So this question is directed to the panelists, starting with Millicent, and we'll end with Dr. Thomas and then go to the next thought leader. Harriet Tubman.
Strength.
Brave.
Resilience.
Brenda.
Right. Faithful.
Lakeila.
Fearless.
Dr. Thomas.
Warrior.
Awesome. Same rotation. Rosa Parks.
Wise.
I'd say courageous.
Committed.
Strong.
Loyal.
A lion.
Maya Angelou.
Intelligent.
Visionary.
Saged.
You stole mine.
We can share. We can
Okay.
share.
We'll share.
You can repeat it. You
Say.
can repeat it.
Say.
Okay.
Phenomenal.
Provocative.
Dr. Dorothy Height.
Stylish.
Trailblazer.
Renaissance.
I'm always the one that pauses because there's so many words.
Take your time.
Resilient.
Inspiring.
Stately.
Coretta Scott King.
So I'm gonna go a little bit, a quiet storm.
Okay.
I would say unwavering.
A backbone.
Mm.
I still have to go with, mine was also going to be a quiet storm, so I'm going to go with that.
Okay.
Regal.
Great partner.
Very good. And the last thought leader, Michelle Obama.
Ah, phenomenal.
I'm going to say powerful. Powerful.
Transcendent.
Wise.
I'm going to say forever because she's my forever first lady.
Yes.
Absolutely. Absolutely.
Yeah.
I would say transformative.
Thank you. As we close, I want to say thank you from the bottom of my heart to each of our panelists that have joined us tonight. You are amazing to me. I am inspired by each of you. I love you all very much. And to our attendees, thank you so much for being here. And I look forward to seeing you next time around. God bless you all. Stay safe and have a wonderful evening. Good night.
Good night.
Night.
Thanks, Tanya.
Thank you.
You're welcome.
Thank you, ladies. Thank you. Thank you.
Bye.